around the world are rolling out vaccination programs in an effort to stop the spread of the coronavirus. But many countries, including the US and Germany, are falling far behind projected rollout goals. The vaccines currently available require people to get 2 shots, and those come 3 weeks apart. But now many experts say it would be better to stretch the waiting period between doses to 3 months. That would allow more people with some resistance to the virus. Britain is the first country to announce that it will delay the time between the first and second dose. And for more, I'm joined now by John Campbell, a medical teacher and author in Carlisle in Northwest England. Happy New Year to you. Thank you for joining us. The British government will start vaccination with the newly approved Oxford AstraZeneca vaccine on Monday. From the beginning, they plan to delay the second dose to get more people at least their first shot. Do you find this to be a good idea?
Yes, very much so. When they look back at the data from the clinical trials that were done on the Oxford vaccine, they found that 3 weeks after the first dose, people had 64% protection against getting an infection, which of course is great. But they also found out that no one was hospitalized 3 weeks after the first dose of the Oxford vaccine. So this is protecting against severe disease and hospitalization and subsequent death. This is the really important thing, because the health service at the moment in the UK is under severe strain. It could be overwhelmed shortly. So we need to keep people out of hospital. And all the data so far is showing that 1 dose of the Oxford vaccine will do just that.
What are the risks involved in it? Because surely some people who've been promised a 2-vaccine regime who only get 1 will think, well, I'm not getting the full deal, am I?
That's right. They're not getting the full deal. But what we need to do is protect as many people as quickly as possible to prevent severe illness and people going into hospital and people dying. Now, the immunity will be boosted when people have the second dose of the Oxford vaccine. It will go up to perhaps 70 or 80%. But the key thing, the immunity will last for much longer. But because we're in a state of national emergency, it makes perfect sense to give as much coverage as possible, starting with the people that are most vulnerable and stopping them getting sick and stopping them getting hospitalized. I believe this is absolutely the right thing to do at this time.
And of course, AstraZeneca's approval in the UK is a game changer. Can we expect to see it also approved in the European Union?
Well, I really hope so. The European Medicines Agency, as far as we know, are not actively considering this at the moment, and I really don't understand what's going on here. There needs to be proactivity, because Europe has pre-ordered 400 million doses of the Oxford AstraZeneca vaccine, and they need it desperately. I really hope this is sorted out. And in the meantime, the British government has also advertised or advocated that the Pfizer vaccine should be given as a single dose as well, because that gives 52% protection against getting the infection, and it looks like it gives 90% protection against getting severe disease and hospitalization. So I think this is something the national authorities and the international groupings need to think of really urgently, to give 1 dose of the Pfizer vaccine to be going on with, and then give the second dose within 3 months.
John Campbell, thank you very much there for us from Carlisle in England. Let's turn our attention